Hi, I'm Dr. Cheryll Sibayan, a fellow of the Obstetrical Gynecological Society, a specialist in women's health. The most common one is backache, no? This is because nag-change na yung curvature ng spine, no? As with a growing belly. Of course, this could be relieved by one is wearing a maternity belt. No, I usually tell them to wear it at the lower part of the abdomen. And then exercise would also help backaches. Next are the swelling of the legs. You call that edema. Of course, if at the end of the day, you could raise your legs. Exercise will also help this. And then increased leukorrhea or mas heavy yung vaginal discharge mo. So refrain from using panty liners and use 100% cotton underwears. Of course, I usually tell patients to start monitoring already for the fetal movement. No? So, with this, they have to take any meal, no? And then lie down on their left side, rest for mga 30 minutes. Count the kicks of the baby for an hour. If you have 10 counts, 10 movements in an hour, then the baby is fine. Yes, of course, exercise is still recommended during pregnancy. But of course, you have to understand that there are certain exercises that you should also avoid. Like for example, if you do exercises on the floor, make sure na don't stay on a supine position that long. And then, yung excessive fatigue. If you think na napapagod ka na, try to rest. And then, you should also avoid exercises that would require balance because yung risk of injury or falling, no? If there are other medical complications, like for example, hypertension, preterm delivery, if you think preterm labor, if you think na you have premature contractions and then your placenta previa mas mababa yung inunan mo, or if you have a cardiac disease, then you should refrain from doing excessive exercise or any form of physical activity. You should see your doctor starting 28 weeks every 2 weeks until the 36th week yon. And then starting 36th week, then you should see your doctor every week thereafter until you deliver.